Today I'll be discussing the newer classification of epilepsy and seizures, and among them, one of the very important thing is focal seizure. So in the newer classification, seizures are divided into two major categories. They are the focal seizures and generalized seizures. Focal and generalized. So what do you mean by focal seizure? Focal seizure means the manifestations are arising from a network in a region or networks involving a single hemisphere. So that is the feature of a focal seizure. Focal seizures are divided into two major types depending upon awareness. So awareness is the fundamental thing by which you differentiate or subclassify focal seizures. The previous terminologies like simple focal, complex focal are abandoned. Now they are not used. So awareness and impaired awareness or impairment in awareness. So let us think about focal seizure with awareness. They are again divided into two types. One is predominantly with a motor manifestation and non-motor manifestation. As I have already told you, the manifestations depend upon the area from where or which network is getting activated or synchronous discharges are going on. If it is in the motor cortex, you will get a seizures. The manifestation of focal seizure is motor. Example, twitching of the fingers or twitching at the angle of the mouth, adversive movement, head turning to one side. These are all examples of motor seizures with preserved awareness. Non-motor means the manifestations are arising from areas, other networks in other areas. Like in the sensory cortex, you get sensations. In the occipital lobe, you may get a visual. In the temporal lobe, you can have different other manifestations like abnormal smell or disequilibrium, etc. So this classification we understood. Now we will think into seizures with impaired or impairment in awareness. So the patient is not in touch with the surrounding. So the classical feature of focal seizure with impaired awareness is that they are not touch with surroundings. If you call the patient, they are unable to respond to that environment. That is a feature of impaired awareness. This can have features like automatism. Automatism is something the patient making some movements, for example, lip smacking, fidgeting, even revolving around. All these patient is not able to, or they are not aware of it. They cannot remember this after the end of seizure. So they are automatisms. Or they can have premonitory manifestations preceding this, followed by impairment in the awareness. Hope this point is clear to you. So basically we divide the focal seizures into focal seizure with awareness and impaired awareness. Hope this is clear. And the motor type of focal seizure can be associated with features like Jacksonian, that is the marching on phenomenon, adversive phenomenon, Todd's palsy, that is temporary paralysis lasting for several hours following a seizure, or epilepsy partialis continua. So these are other manifestations. Another important point to be remembered is that these focal seizures can spread to other networks and produce generalized seizure. So generalized seizures can occur from focal onset becoming secondarily generalized. The diagnosis mainly from history taking, interictal EEG, that is EEG taken between the seizures, may not show any findings, and sometimes you may have to use deep electrodes for localization. So in conclusion, today we have discussed about focal seizure, the classification into focal seizure with awareness and impaired awareness, and the different subcategories of it. And the most important thing, a focal seizure can spread on to leading on to secondary generalization. The treatment and approach to a patient we'll discuss in another session. Thank you.